the first of our speakers, Rachel Carey, who, for those who weren't here at the beginning, is Chief Scientist of Zinc. Rachel, welcome.
Thank you, Susan, and thanks, Danielle. Hi, everyone. It's lovely to be here. As Susan said, I'm Rachel Carey. I'm Chief Scientist with an organisation called Zinc, and I also have an honorary role at UCL. I'm going to speak for just a few minutes, and I want to cover, first of all, what I see as the relevance and value of the behavioural science principles and tools that this course covers in the context I work in. And then secondly, I want to just highlight a couple of reasons why I think this particular course will be so valuable. So I've spent the last few years applying behavioural science principles to a range of different behavioural domains and sectors. And for the last 4 years, I've worked in early stage innovation, supporting startup businesses focused on important societal issues around health, education, employment, etc. This course will introduce participants to a number of resources and frameworks that I was immersed in when I worked with Susan and colleagues at UCL, and that I now use all the time in my day-to-day work. I draw on them to help the entrepreneurs I work with to define and understand the problems they're tackling, to put structure on the data they're gathering, and to create and test interesting and evidence-informed innovations. I think in the world of early stage innovation, there is so much uncertainty and so many variables that these types of tools that offer a structured, systematic approach can be really key in helping businesses to progress up the learning curve as efficiently as possible. And also in a way that I think is very complementary to other approaches in innovation and from user-centered design and user experience research. And in my experience, one of the most valuable things about this content is that it can provide an end-to-end process. So as Danielle mentioned, taking you from a broad, complex problem through to developing, deploying, and evaluating an intervention. But these approaches have been designed and are taught in such a way that they can also be applied flexibly and iteratively, and you can decide how to apply them and when to apply them in your particular context. I think that's really valuable. So I'm delighted to see this short course being launched. The need to understand behaviour and create interventions that can lead to lasting behaviour change feels extremely salient and timely, and I think you can see that from the number of people who've joined this call. So regardless, I think, of your organizational context, career stage, geographical location, area of interest, the behavioral science approaches covered by this course provide a really strong, solid foundation and a way to bring clarity and structure to thinking and projects. The final thing on this course that is particularly interesting, I think, is that the length and format and structure is extremely inclusive, and I can see it working really well for folks in settings like mine who might not have the time to dedicate to a full-time MSc program, for example, but also want something more substantive than a once-off talk. The structure will also mean that participants have an opportunity to apply the learning in practice around the course. So I'm really delighted to be here as part of the launch, and look forward to being able to direct people to this course as a great way to get an overview of the principles by this amazing team at CBC. So thank you very much for having me.
Thank you, Rachel, for being here. And Rachel's been a very good friend to the Centre for Behaviour Change, as is our next speaker, Professor Angel Chater from the University of Bedfordshire. Welcome, Angel.
Thanks, Susan, and thanks for having me. So again, like Rachel, I'll give you a bit of an overview of how I use this approach and this modelling in my day-to-day work. I work a lot with individuals in public health consultants, people who are developing public health programmes, but also within research through my research centre at the University of Bedfordshire. And often what what happens is individuals working within these areas are very keen to try to change health outcomes, obesity levels, diabetes levels, things in relation to cardiovascular disease risk or mental health, which is the main areas I work in. But they often want to jump to the end before considering what needs to go into an intervention or doing a needs assessment on what the barriers might be to individuals. So I work quite closely with people to develop real world interventions that help to understand people living with these sorts of conditions and what barriers there might be to their behaviours, both on an individual level, but also from a population based level. So these might be things like helping people to break up their sitting time, physical activity, helping people to take medication as prescribed. But I also work quite closely with training healthcare professionals. So GPs or nurses or pharmacists or sport and exercise professionals who are helping people on the ground. And often what they tell us is to go along and do kind of longer training is quite difficult for them. Pharmacists, for example, need to backfill their time, which would cost them money because they need to bring another pharmacist on site. So often training would be required in evenings or weekends, whereas a course such as this would enable them to be able to work during their own time. It's the same with sports coaches. Often training within their day-to-day time would take money away from where they could be working with their clients. And we've recently done some interviews with people in local authorities about how to support population health. And they really recognise the importance of behaviour change and the importance of understanding the approaches to how to support behaviour change in the best possible way. Because behaviour is at the heart of everything they do. It's at the heart of the populations that they serve. It's at the heart of the behaviours, of the health professionals who are trying to help people to change their behaviour, and also their own behaviour, you know, in the way in which they commission programmes, commission training, but also how they put out their comms, for example. So we've done quite a lot of work recently with the COVID-19 response and how to support people to engage in disease prevention behaviours. And so a lot of this stuff would really benefit from this short course. It opens up opportunities for people to be able to engage in their own time, but also gives people access to be able to come back to the team to check in with them to see how they're using it on the ground. And just to end, one of the recent strategy documents that have come out from Public Health England, the Behavioural and Social Science Strategy for improving population health and wellbeing, has really called out for building capacity within public health in the area of behaviour change. So this type of course really opens up the opportunity for people to be able to learn these skills and be able to apply them in practice. So yeah, hopefully that helps. Over to you, Susan.
Thank you, Angel. And so far we've heard from people who've all been in the UK, but this course is a global course, hence being online. And indeed our face-to-face courses have people always from several continents and many, many countries. So I'm delighted to welcome our next speaker who will bring an international global perspective to the discussion, Elena Altieri, who is Head of Behavioural Insights with the World Health Organization. Welcome, Elena.
Thanks a lot, Susan. Good afternoon, everyone. Thanks for having me here today. So, as mentioned, I lead a new initiative at the World Health Organization, which mainstreams and scale up the use of behavioral science in public health. Today, I'm joining this event to briefly share my own particular views of how behavioral science and public health, why behavioral science is important for public health. And these views are sort of determined by two key factors. First of all, I'm a practitioner rather than academic. And as a practitioner, we try to translate theory into practice. We try to translate frameworks into action plans, evidence into interventions and decisions. So in other words, we battle daily on one fundamental question. How can we use more and better behavioral science into our work? Today, I also bring here a global perspective, as Susan was saying, since, as you probably all know, WHO is an international organization that works at the global level for global health, particularly at the headquarters, which is where I am based. And this is a challenge for behaviors because you can talk about behaviors globally and in general, but the real measurable changes the ones that have an impact on people's health and their access to health, really happen at the community level in given contexts and settings. So why am I here today? Mostly because I can barely think of one public health challenge, global or local these days, where behaviors of the population or of the health workers or all those who work in the health system and provide access to health are not important. Every single service we design needs to be used. Every policy or recommendation we develop needs to be accepted and adopted. Any new medicine needs to be taken as prescribed. And yet most of the public health community at the global and local level still struggles very much to include the behavioral perspective, behavioral insights into their day-to-day work. So I'm also here today because capacity in the application of behavioral science seems to be a barrier across the spectrum to a more systematic use of behavioral science, behavioral approaches, behavioral evidence, techniques in public health. Recently, we have conducted a survey among our workforce, and that has been the #1 finding. Colleagues value the input of behavioral science to their work. They are aware of how we can complement the biomedical approaches, and they would definitely like to use it more frequently, more systematically, yet they need support to build their own capacity and skills in this field. So capacity and skills are perceived by them to be as a key capability barrier, capability obstacle to a more systematic and rigorous use of this field in support of public health globally and locally. So luckily these days, compared to when I started back 20 years ago in the UN system, the offer now is extensive out there. We have new technologies, we have online trainings, we have easier access to high quality academic work and key tools and concepts. We have easier access to knowledge sharing and lessons learned. And so we can all be better equipped to ensure that the understanding of people's behaviors is indeed embedded into the public work and public health work in particular. So in conclusion, I think that we have a great opportunity here. Not only we've been witnessing over the last 10 years an increased interest for the field of behavioral science applied to public policy, of course also public health, and this interest is beyond the interest of those who work on it directly. So I'm talking about governments and policymakers across the spectrum, but we've also learned a lot from the recent events, where behaviors at the individual and community level have proved to be key to fight against the pandemic. So I personally celebrate any effort that contributes to make it easier to include insights on how people behave and why into public health. And in fact, also at the WHO, we're working on a series of courses precisely to build that capacity. And I really want to thank personally the efforts of Professor Miki and her team for the continued contribution and efforts in this area towards this sort of global agenda and global program. So many thanks again, once again, and back to you, Susan.
Thank you, Elena. Thank you for those very generous remarks and very helpful contribution. So continuing with our global theme, I'm delighted to welcome our final speaker, Javiera. On the screen is Rosenberg, but I think you can let us know what your real surname is, who is policy advisor at the Ministry of Women and Gender Equality in Chile, and also is one of our Behaviour Change MSc alumni. Javiera, welcome.
Hi, Susan. Thank you for having me. It's Javiera Rosenberg. And I'm super happy to be here. Thanks for inviting me to share my experience in behavior change. As you say, Susan, I'm part of the 2018 cohort of the MSc in Behavior Change. And now I work as a policy advisor at the Ministry of Women and Gender Equality in Chile. And I'm here to tell you why this course is a good choice, whether or not you want to pursue a career in behavior change. As you may know, behavior change is a new and emerging field increasingly present in the public and the private world in different areas such as finance, sustainability, education, gender equality, health, among others. Behavioral science are playing an increasingly important role in developed countries and have started to play it as well in developing countries in the same way. When I finished my master's degree, I started working in the Chilean government, where behavior change was non-existent. However, I have seen how this has changed through the years. And in the 3 years that I have been working there, I have the possibility of working with different ministries in different topics, proposing new solutions to the same problems that I have seen solved with the same approach all the time. For instance, today I'm working with young women to design a behavior change intervention targeted at police officers in order to reduce gender-based violence. And I'm also working as an independent consultant to increase the uptake of digital technologies among frontline workers. In my 3 years working in the government, I have been working with different stakeholders, and at some point, all of them are open to behavioral science. And I think that key to this success is that behavior change has allowed me to propose a new approach to solve recurrent problems that have used the same strategies again and again. And I think this is key because these strategies many times have poor results or no results at all. Behavioral science, in contrast, has allowed me to present new, comprehensive, and targeted solutions to these challenges. So I hope this course will give you the tools to do the same in your context. Related to my first point is that many issues require understanding of human behavior to design effective solutions. Not only behavior change, complex behavior change interventions. You can use the tools you will acquire in this course where you are working in a new government program, but also if you are developing your startup that needs to promote the uptake of digital technology. So my third point is that I need to mention that I know and I'm aware that behavioral science courses are scarce, are expensive. I have seen that. And I think this is unfortunate because many practitioners need to quickly acquire and apply the basic tools of behavior change without excessive payments and in a short time. So I have seen this in my work where public sector workers have reached out to me asking for this type of support. Fortunately, the learnings that I acquired in the MSc have allowed me to run workshops for many public servants a few times a year. So I'm very proud of that. But I know this knowledge is scarce and this support is more needed than ever. So I hope this course will respond to this need, and I think it's also a helpful solution if you are interested in this field, but you aren't sure whether it's the right path for your career or not. So thank you for having me. This is just my perspective, but I hope you will enjoy the short course, and I think it's an enormous contribution to the behavior change field. Whether you are working in the private sector or the public sector, I think it's a good choice.